Hold the needle about 1/3 to 1/4 from the back of the needle on the flat surface with the tip of the needle holder. This allows for an easy rotating motion of the wrist to take the needle through the skin. When suturing a wound, we suggest starting in the middle and then progressively halving the gaps in between to ensure even distribution of sutures. For a simple interrupted suture, insert the needle at 90 degrees to the skin and with a rotating motion of the wrist, simply twist the needle through. You could also insert on the one end, come out the middle of the wound and insert again. Pull the suture material through, leaving just enough to suture. There are many ways to tie an instrument knot. One way is the following. Turn it twice around the instrument, grab the suture and pull it across the wound as such. Only enough force should be applied to approximate the wound inches and avoid excessive tension across the wound. Now rotate the material in the opposite direction around your instrument, grab the tip and tie another knot. Finally, 2 in the direction, same as before, and complete your knot. Seat the knot over one of the entry edges and neatly trim the edges of your suturing material. Another useful suture to use is a vertical mattress suture. A vertical mattress suture takes a bite of tissue that is slightly further and deeper than a simple interrupted suture initially, as an initial throw. Reverse the direction of the needle on your instrument so that you can come back across the wound. To come back across the wound, go shallow and close to the wound edge, grabbing only a small piece of skin. Pull the suture material through until you have just enough to tie the knots. Knot same as before, 1, 2, put it across, 1, put it across, and finally 1, 2, and put it across. You will notice that the suture lies to the side of the wound with no material crossing it, and that it results in slight eversion of the wound edges, which may promote wound healing. Finally, I will show you a pulley suture, which is a variation on a vertical mattress suture and is an extremely useful suture when trying to suture wounds that gape widely or under a lot of tension. Position the needle correctly and start off with a vertical mattress suture as shown before. Deep and far, deep and far. Switch the position of the needle and now come back close and shallow, and again close and shallow. If you were to complete the suture now, this would be a simple vertical mattress suture. Instead though, pass your needle through this preserved proximal skin loop, represented on the vertical mattress suture as that, pass it through, and now tie the knots. 2 and pull, 1 and pull, 2 and pull. Trim the edges of the suturing material. By passing the needle back through the proximal skin loop, you have created a pulley effect, allowing the physics of this configuration to spread the tension across the wound much more efficiently and close wounds even under a lot of tension much more efficiently. One potential use for a pulley suture is to do the initial halving or maybe even the second halving and then fill in the rest with simple interruptions.